understanding why knowing your numbers matters, what qualifies as high blood pressure, and what you can do about it. Now, high blood pressure is often referred to as the silent killer, and that's because it can quietly damage your health over time without any noticeable symptoms. It affects people of all ages, backgrounds, and walks of life, making it a significant public health concern. It affects millions of lives around the world, and today we are taking a significant step towards understanding and managing this critical health issue. And so, why is it crucial to know your blood pressure numbers? Well, to me, the answer is quite simple. Knowledge is power. And when you are aware of your blood pressure numbers, you can take proactive steps to manage it and reduce your risk of complications. Regular checks of your blood pressure can help identify any potential issue early on when they are easier to control. And today, we are here to empower you with the knowledge, to encourage you to take charge of your health, and to emphasize the importance of those two numbers that make all the difference. In medical terms, it's called the systolic and the diastolic blood pressure. In simple terms, it's the top and the bottom figure that you see on a blood pressure machine. But what exactly is high blood pressure? It's a condition where the force of the blood against the wall of your arteries, and arteries are just um, tubes almost that go from your heart to the rest of your body. The blood pumping against the arteries is consistently too high, where the force is too high. Now, this can strain your heart, it can damage your blood vessels, it can lead to a series of health problems such as heart disease, stroke, kidney damage, and more. So, this session is not just about raising awareness, it's about giving you the tools and information that you need to live a healthier, happier life. We know that your health is in your hands, and knowing your blood pressure numbers is a critical step on that path. Together, this evening, we're going to discover how even small changes can lead to big improvements in your health and well being. So, I'm delighted to announce that we have a panel of experts with us here today, and they are here to share their knowledge and expertise and to address your questions and concerns. So we have Dr. Shahid Ahmed, who is our National Clinical Director for Cardiovascular Disease Prevention. I have Tessa Linfield, who is the Director of Public Health for all of Berkshire East. I have Yusuf Ahmed, who is our Frimley Health and Care ICS Chief Pharmacist. And I have the pleasure of being joined by two of our local GPs, Dr. Nityananda, who is a GP in Slough, and he is also our Frimley Cardiovascular Clinical Lead. I have Annabelle Buxton, who is a GP in Bracknell and is also the lead for the place of Bracknell. So what we have planned for you today is a short presentation from Dr. Shahid Ahmed. You will then hear a patient story, a lived experience, and this will then be followed by a question and answer session and demonstration of some useful links on our website before we close. So I want to emphasize that this session is a unique opportunity for you to gain insights and advice. So please don't hesitate to ask a question on your mind, even if you think it's quite simple, because others are probably thinking the same. So do ask your questions in the chat. We will go through all of them. I'm also thankful that I have some clinical colleagues who have joined to answer some questions in the chat. And any unanswered questions, we will answer at the end of the meeting. If need be, we will send you communications. So this is for you. So before we begin, I just also wanted to add that today is about blood pressure and all things related to blood pressure. So I'd very, very gently request that the questions pertain only to this topic today. We also want to use the chat function predominantly so that we can be more efficient with our questions. And just a reminder that although our specialists can provide general information, they can't offer personalized medical advice without full evaluation. So you may need to consult your GP or health professional for specific concerns that you think aren't addressed today. So, having said all that, let me hand over to Dr. Shahid Ahmed to begin the evening for us.
Thank you, Lalitha, and thank you for inviting me here today and convening both an esteemed panel, but also getting such a great audience along as well for the presentations. So my name's Shahid Ahmed. I'm the National Clinical Director for Cardiovascular Disease Prevention, and I'll talk to you today about tackling high blood pressure. Next slide, please. A couple of years ago, somebody asked me, Shahid, why are you so interested in this blood pressure project? And I sat in a reflection and thought, what I'm really interested in is saving lives, reducing disability, and reducing health inequalities. And it just so happens that by controlling blood pressure, it's one of the best and fastest way to save lives, reduce health inequalities, and reduce disability. So that's why I'm interested in blood pressure, for all of those other reasons. Next slide, please. So this slide and the slide after are from the CNN website. This talks about the global impact of blood pressure. There are 10.7 million deaths every year from high blood pressure. Hypertension or high blood pressure is the leading risk factor for preventable deaths worldwide. Next slide, please. And most people with high blood pressure globally do not have it under control. We have across the world 1.4 billion people with high blood pressure. Some of them are aware of it, some of them aren't. Some of them are treated, some of them aren't. Some of them are controlled, some of them aren't. So of the 1.4 billion people worldwide with high blood pressure, only 192 million have it under control. And actually yesterday, the World Health Organization released its hypertension report. Next slide, please. And across the world, we know that improving blood pressure is one of the best things that we can do for the economy. And on an individual basis, if we can keep people healthy by controlling their blood pressure, we can stop them from having heart attacks and strokes, and that then helps them lead healthy lives. Next slide, please. So what have we been doing in NHS England to help people control their blood pressure? Well, number one, we've had a blood pressure at home programme where we've been supporting people to monitor their blood pressure at home. We've distributed 220,000 blood pressure monitors across the country. But also we know that roughly 1 in 3 people with high blood pressure has their own blood pressure monitor. And people have been increasingly sending blood pressure readings in to their general practices and without having to physically go to the general practice to send their blood pressure to get their blood pressure on the practice system. So home blood pressure has been really, really well thought of across the country. Next slide, please. We've also been making it easier to get your blood pressure measured in many other places. So we've commissioned the Community Pharmacy Blood Pressure Check Scheme, where people can go into the pharmacists who are participating and get their blood pressure checked there. We know that many people have been getting their blood pressure measured when they get their vaccinations. And we know that some areas have been actually sending buses out to do numerous things, including measure people's blood pressure. Next slide, please. So one of the things that we do at a national level is that we identify best practice and we help disseminate and share that best practice. Next slide, please. And we've commissioned videos in multiple languages to help people understand what the benefits are of home blood pressure monitoring. Next slide, please. And we've been doing quite a lot of public communications to help people understand why blood pressure is really important and what the numbers mean. Next slide, please. And of course, we've been supporting areas to do local awareness raising. And I love the YouTube video here where Dr. Nanda on the Frimley website tells people how to measure their blood pressure and what the blood pressure means. But also many other people in other areas have been conveying similar messages as well. Next slide, please. And that's my slides done.
Thank you very much, Shahid. I know you have had competing appointments today, yet you've taken the time to be with us. Thank you for that. And I know you can't stay to answer questions, but we appreciate your time. We now have a story to share with the public, and I hope you can stay at least for that part of it. So we know that it's not just medical expertise that guides us on our journey to better health. Often personal experiences can be the most inspiring and enlightening. And today we are privileged to be sharing with you Natalie's journey to remind us that high blood pressure with the right knowledge and support can be managed and even conquered. So Ollie is going to share a video that tells you Natalie's story. It's a 3 to 4 minute video, and Natalie is in the audience, I believe, as well. So thank you very much for sharing your story. So Ollie, I'll hand over to you.
Hi, my name is Natalie. I'm 50 years old, and in 2015 I had a stroke. It was a hemorrhagic stroke, so a bleed in the brain. On the brain, I had an aneurysm. It just ruptured one day. I was doing a charity bike ride and I overdid it. Massive pain in my head. I fell off, and that's really all I remember. I was taken to 2 hospitals. Basically, they saved my life. But I had another bleed in the operation where they were going to fix it, and I had a much bigger bleed the second time, which is what caused a stroke. Now, I feel I've been very lucky because lots of people have completely lost their speech, but I didn't have that. So although I've been physically disabled, I've still got my speech and my cognitive, I don't know what to say. Obviously, I trip over my words quite a lot, but actual speech is okay. I'm not great at talking on the phone. That really confuses me. I have a carer that gets me up every morning because I can't get myself dressed. Well, I can do the bottom half a bit, but I can't do the top half at all. My left leg is, I'd say, probably about 40–50% working, but my left arm is probably about 10%. I've got my shoulder working, and that's it, nothing else, I'm afraid, which is a bit depressing, but you know, I'm still alive. Lots of people haven't survived this sort of thing. I did have a bit of high blood pressure. It wasn't exceptional, but it was enough to make it not great, because I had asthma as well. So every time I had an asthma review, they did my blood pressure. I was quite overweight and didn't really do that much. I went on the occasional bike ride and a bit of table tennis, but I was quite inactive. To keep blood pressure down as much as possible and keep your weight down, that was a really big thing with me. I was much too overweight and stress. Everyone I know who's had a stroke has had stress beforehand. So trying to keep away from that is ideal, but obviously it's just not that easy. You need to get the blood pressure checked regularly. It's really important, if you can, to try and keep your stress down. But yes, that's easier said than done. And if you can do some exercise somewhere, you can do that, even if it's walking up and down the stairs or just even going up and down the garden. Whatever you can do, small or, you know, as you can, or that you have to, just something little would help. But yeah, checking it every few months is vital, I'd say. Then you can get on the right medication if you have to.
Thank you. Natalie, we deeply appreciate you sharing your story and contributing to our event. Your perspective is invaluable to us and to everybody on this call. So thank you once again. And Shahid, thank you for joining us. So
thank you for inviting me.
Thank you. I want to remind the public that please feel free to write your questions in the chat. I am going to just warm us up by starting off with a few questions. So that allows you a bit of time to ask your questions. So if I could start off by asking Dr. Annabel Buxton, to tell us a little bit about what causes high blood pressure.
Thank you, Lalitha. As you mentioned in your earlier introduction, you mentioned about pressure of the blood in the tubes called arteries, the vessels that carry sort of blood from your heart to your brain and the rest of the body. And of course, we need a certain amount of pressure to get the blood moving around the body. Blood pressure obviously goes up and down throughout day and night time, and it's normal for that to happen. But what we're talking about here is when blood pressure is consistently too high on that front, and that can be contributed to when your blood pressure is high all the time, and those arteries, which are normally stretchy, become stiff or narrow on there, making it easier for fatty material, which we call atheroma, to build up on there, and that's when it can lead to the complications, such as with the story that we've just heard in terms of things like heart attacks and strokes. One of the things that Natalie mentioned in terms of things that can contribute to blood pressure, she mentioned being overweight, and that is one thing that can contribute to high blood pressure. There are a number of other factors that can also contribute to blood pressure being raised. As we all sadly get older every day, that is also a contributing factor, as are genetics and family history. So if somebody in your family has got a history of blood pressure, that can also be a contributing factor. There are, alongside genetic and family factors, be of course factors in your lifestyle, and I think these are things that we'll come on to through the next set of questions perhaps, but some of those being things such as smoking, drinking alcohol, salt in your diet, and people who are sedentary or not achieving as much exercise as would be optimal on there. So those are some of the factors that can contribute. And then in cases of other things, there would be some medical conditions that can contribute to what we call a secondary or a byproduct of those conditions that can cause a high blood pressure. Some of those being things such as diabetes or problems with your kidneys, for example. And sometimes on occasion, it can be other medications, for example, that can contribute.
Thank you, Annabel. And I'd like to pick up on your question and go to Tessa to talk a little bit about the risk factors for developing high blood pressure a little bit more, please, Tessa.
Yeah, no problem at all. Happy to do that. So as Annabel mentioned, you know, that getting older means that you're more likely to develop high blood pressure. It is more common, particularly as you get towards retirement age and that kind of family history. So there are some things that you can't control. You can't control how old you are. You can't control your family history. And there are some communities that are more prone to developing high blood pressure than others. So that if you come from a Black African or Black Caribbean descent, you have a higher chance of developing high blood pressure, and some South Asian communities also more prone to diabetes, which, as we've heard, also can lead to high blood pressure too. So there are some things that you can't change. You can't change any of those things, but then there are other factors that are kind of modifiable, that are also risk factors for developing high blood pressure. And key to that are risk factors also for heart disease and stroke. So we know that risk factors for heart disease and stroke, of which high blood pressure is one, are kind of cumulative. They add to your risk together. And a lot of the causes are common for some of those risk factors. So we know, for example, that if you smoke, you're more likely to have high blood pressure. And clearly that's something that we can change. We can change our smoking behaviour. Drinking too much alcohol. So we know that there are guidelines about how much alcohol the sort of maximum levels that we should be drinking. But really what we should be looking at is trying to have some alcohol-free days in our week and really checking and looking at the amount of alcohol we're consuming. So smoking, alcohol are risks, an unhealthy diet where you're not having enough fruit and vegetables and eating too much salt is a key risk for high blood pressure. And also the kind of, along with diet, the amount of physical activity that we're doing as well. So if you're someone that sits around a lot and isn't out and moving regularly and taking exercise, then again that increases your risk. And of course both of those, the diet and exercise risks, also increase your risk of carrying too much weight, and carrying weight particularly around your middle is a particular risk for high blood pressure.
Thank you. Thank you very much, Tessa. And Niti, if I could come to you next and ask you what the consequences are of untreated high blood pressure.
Thanks, Lalita. Yeah, so having seen patients in the clinics and in our daily lives, high blood pressure is can be devastating, as we've just seen the video of one of our patient stories here. Uncontrolled blood pressure can really cause lots of complications. Some of the complications of sustained high blood pressure is around, just if you imagine a pump system, how the pump can really burst, and that can cause bleeding in the vessels of the tiny vessels of the different organs of the body. Stroke is a consequence of that. The two types of stroke, which is hemorrhagic, where the bleeding happens and then it causes pressure and causes disability that we have just heard. A heart attack can be caused by high blood pressure, one of the common causes in this country for causing and contributing to a heart attack. You also have some of the other emergencies and acute or immediate threatening complications with undiagnosed high blood pressure. If our patients have heard, or public have heard of something called aneurysm, for example, you can develop bleeding from the aneurysm, as well as the aneurysm being enlargement of the big vessels of the heart as well. Aortic aneurysm is one of them that can be caused by the high blood pressure. High blood pressure also causes damaging effects on the kidneys, which is a sustained longer-term kind of complication. We tend to see that in patients with high blood pressure not well treated, the tiny filters in the kidneys start getting damaged over a period of years and start leaking proteins. And in combination with diabetes, can really affect the kidney functions and cause kidney failure. So one of the big problems with the high blood pressure, and many times, is that people cannot recognize that as a symptom. Some patients come with dizziness and headaches and that sort of symptoms, and we incidentally find that out. But many times, unfortunately, we tend to see patients coming with these complications as a first presentation, and that can be really difficult to comprehend for patients as well. So worthwhile knowing your numbers and managing it early on is what I would say. Yeah.
Thank you. Thank you very much. So Yusuf, I'd like to come to you now. Members of the public and all of us go quite often to pharmacies looking for paracetamol or for medication for hay fever and so on. And it would be quite good for us to share the role of community pharmacies in relation to this whole blood pressure, be it detection, control, and so on.
Yeah, thank you, Lalita. And good afternoon or good evening, everyone. High blood pressure is a personal story for me, as I have a father that has high blood pressure, and my late grandfather had high blood pressure as well. So this is something that's commonly discussed in my household, and is very important for everyone to understand what high blood pressure is. Community pharmacy can play an essential role in helping all members of the public understand more about what high blood pressure is. A few years ago, in 2020, NHS England commissioned a pilot which involved community pharmacies offering blood pressure checks to those people aged 40 and over. They also were offering 24-hour ambulatory blood pressure monitoring. So this is a more sophisticated way of monitoring your blood pressure. Through that pilot, through that successful pilot, there was a commissioning of this community pharmacy high blood pressure service throughout the country. So it forms part of the community pharmacy contract. And the service itself has a number of key aims. Firstly, is to identify people age 40 or older or younger at the discretion of the pharmacist to have their blood pressure measured. also one of the aims is to refer patients that have been identified with high blood pressure to their GP. Another key aim is dialogue with general practice to allow individuals that our GP colleagues identify to have their blood pressure measured in the community. So there's a real practical action that community pharmacies can do to help you have your blood pressure measured. In addition to that, as many members of the public know, community pharmacies offer a range of services which help you to understand more about health conditions like high blood pressure. So understanding the causes and the treatments, as well as understanding some of the risk factors which you've heard some of our panelists speak about today. Another excellent thing that the community pharmacist can do is help on advice on diet and alcohol and smoking. And these are, again, as mentioned earlier, key risk factors that it's important to understand and to control. And lastly, one of the wonderful things about community pharmacies is that they're on your doorstep. You don't need an appointment to attend, and they're widely available to offer advice on a range of topics, including blood pressure. Thanks, Lisa.
And Yusuf, I'm assuming they don't have to pay for this either?
Yeah, just members of the public do not have to pay for this service, and they don't have to pay for speaking to their community pharmacist.
Thank you, thank you. So my next question is to Annabelle, and I'd like us to touch on how often should a patient have their blood pressure checked, and say they are not known to have high blood pressure, how often, so they go to the community pharmacy, have had their blood pressure checked, everything's fine. The question on my mind is, when do I need to go back and check it, is one. And of course, if I am known to have high blood pressure and I'm taking medication, how often do I need to have it checked?
Thank you, Lalitha. So if you're a healthy adult living in England, Wales, sort of between 40 and 74, you'll be invited for a health check, usually sort of, every 5 years or so. And as part of that, generally a blood pressure check will be undertaken. So within a 5-year time frame. If there's any school of thought that your blood pressure is approaching the upper limit of what would be ideal, then you'll generally be invited to come and have it checked sooner than that. And of course, if you're known to have high blood pressure and you're on medication, then it would be checked more regularly than that by your healthcare provider on there. As we've mentioned, sometimes if you have high readings, we'll take a series of readings, or as been mentioned, they can do the 24-hour ambulatory blood pressure monitoring where you just wear a device for that period of time.
Thank you, thank you. And Niti, if I could ask you, what are the ideal numbers that one should aim for? Because there's also a question in the chat saying, can you tell us the ideal numbers of the top and the bottom figure?
I think it's quite important, isn't it? Because we get confused with various numbers flying around, and we tell our patients, know your numbers. The textbook description is the blood pressure of 120 and 80. However, we all know that as Annabelle mentioned, day-to-day fluctuations do happen, and the body is used to a set value of working well. And the national and the international guidance are based on when the harm can be caused, at what level. So for anybody who is under the age of 75 years, a blood pressure of 140/90 and less is considered the safe zone. And any blood pressure above that value, one would really need to start thinking about whether the blood pressure has been checked in a calm setting, 5 minutes rest, and consistently, if that blood pressure raised more than 140/90, then that needs further attention with your GP or community pharmacist. And if you are aged above 75, I would relax that target, not myself, but international national guidance would suggest a blood pressure of 150/90 is acceptable as a relaxed target. Although home readings can be 145/85, but let's not confuse too much. For elderly patients, 150/90. For less than 75, 140/90. These are the kind of numbers to remember. If you're on treatment, you need to also remember that we need to aim for less than 140 or 80. To all my patients, I tend to give this magic number is 140 or 80. Anything less than that is good. Anything more than that, if you're on medications, then we need to start controlling it better.
Thank you. Thank you. There is a very useful table that Mahmouda has put in the chat. You might wish to take a photograph so you remember it and you can check it if you are checking your blood pressure. It's a table that tells you what is high normal and what is high blood pressure, exactly what Dr. Nanda said just now. So Tessa, if I could come to you next and ask you to talk a little bit of how does exercise affect blood pressure and what types of physical activity are recommended?
Yes, absolutely. So, I mean, exercise is a good thing to do anyway, whether you've got high blood pressure or not, because it will help prevent you from developing high blood pressure, and it will help you if you already have high blood pressure in controlling it better. It's a good thing, and particularly if you don't do anything at all at the moment, doing something is going to be better than doing nothing. Now, I'm not saying that you have to leap off the sofa and start running marathons. That wouldn't be sensible. And if you haven't done any exercise for quite a long time and you do have high blood pressure, you might want to check with your healthcare professional what they would recommend. But I think what we would be looking for is at least half an hour a day of doing something. And that something could be gardening, it could be going for a walk, it could be going out with your dog. What you're looking for is something that gets you a little bit out of breath and feeling warm. So we're not saying that you have to start running or you have to, do anything with great physical exertion. It's about doing something for about half an hour a day that's enough just to get you with that kind of warmed up, flushed, little bit out of breath feeling. And it doesn't have to be expensive. You don't have to go to the gym. You can do it by just, putting a pair of comfy shoes on and going out for a walk. The other thing that exercise really helps with is managing stress. So it's like a silver bullet when it comes to helping people manage anxiety and depression and levels of stress. If you can get that regular exercise, some activity into your daily routine, then it really helps with that kind of stress management as well. So really, it's a really important thing to do to stop you developing high blood pressure in the first place, but also to help you manage it if you do develop it. So yeah, and doing something is better than nothing.
Thank you, Tessa. Yusuf, I'd like to come to you to ask you about the interaction between diet and blood pressure, and people who are known to have high blood pressure. What can they do? What do they need to avoid in terms of foods and so on?
Yeah, thanks, Melissa. Diet is a very pivotal point in a number of health conditions, including high blood pressure. Eating a balanced diet can mean many things to many people. When it comes to high blood pressure, some of the key things around diet is managing things such as salt. And there's recommendations nationally on how much salt an average person should have in a day, and I believe it's 6 grams. But if you suffer from high blood pressure or have risk factors around high blood pressure, then staying well below that is one of the key things that you can do to help with having better diet. Other aspects are around saturated and trans fats. So as many people know, butter and other oil are some of the key attributors to high saturated or trans fat. So it's very important that you have a look on how you cook your food and try to manage things such as butter and oil that allow you to have a more balanced diet. With diet, it's very important that you stay hydrated. So drinking your recommended daily allowance of 2 litres of water a day is, again, another key thing to maintain generally good health, but also helps with good water control in your body as well. One of the things that I discuss quite often with my father at home is having a more rounded diet. So traditionally in our household, coming from a South Asian heritage, we eat a lot of bread, chapatis, and curries. And some of the things that we discuss at home is how can we reduce our carbohydrates, as well as change some of the ways that we cook our food. So being used to having less salt and less oil in our food is something that within my family that we've conditioned over a number of years. So I think that's very important to understand that taste as well as changing the way you eat are crucial aspects in managing your wider health, but also particularly managing high blood pressure.
Thank you, Yusuf. And do you want to name one or two surprise foods that are quite high in salt for the members of our public?
High in salt.
Like canned foods and
yes.
cornflakes,
So
for example.
Processed
Yeah.
food, canned food.
Yeah.
Also, sugar and salt. So any high breakfast cereals and whatnot. So there's quite a lot. I've got into habit, and I've got my family into habit, to looking at the contents and ingredients of what we eat. That is one of the best ways to understand what you're putting into your body, but also understanding what foods are good and not. And currently, we're lucky in the UK that companies that produce our foods are mandated to ensure that the contents, such as sugar and salt and calories, are marked on boxes. So I would encourage you to have a look at the ingredients and the contents of your food.
Thank you. And I think, Niti, you want to come in on the question?
Yes, I just wanted to quickly highlight the importance of not underestimating the salt-ridden potential of the takeaway foods. With COVID and post-COVID, we are used to all kinds of takeaway foods, and there's a culture of a large acceptance of some of the takeaway foods. And because they have to use the preservatives and whatnot, it's very high in salt and sugar. So be aware of that. And you'll notice after a couple of months of eating home-cooked food, if you take a takeaway, they taste different. So I just want everybody to be aware of that. Yeah.
Thank you. And while I have you, Niti, I'd like to ask you two things about blood pressure control. So we'll come to the question on medication in a minute. I've got two questions in the chat. One person who is on medication, but invariably the diastolic, that is the lower number, is high. And they want to know, is there something specifically I can do? And there's another person in whom the lower figure of the diastolic is actually quite low, 70s or so, but the upper number, the systolic, is high. So both of them wanting, obviously, to get better control and asking if there's something they could do specifically.
Sure. I think that's a very important question for patients' understanding. The reason why I say that is as younger patients who developed high blood pressure, their systolic, the upper value, often is just 140s, 145, but actually the diastolic is high. It's the pressure within the extremities of the body which really push back on the force with which the heart is pumping the blood. So that's often the case. But as we grow older, the systolic blood pressure, the upper value goes up, and the diastolic actually is normal or below what we call not relevant kind of numbers. So younger patients with high blood pressure, when I say younger, between the age of 30 to 40 to 60, they tend to have higher diastolic blood pressure. Either way, they do have, we say, uncontrolled blood pressure if they're high blood pressure, if they're 140 or 90 over. So it's really a case of doing the similar things, what we do, especially cutting down on the salt, reducing the weight, and the medications that will really bring down the blood pressure to normal levels. As the age progresses, in the elderly patients, we see the systolic blood pressure going up, mainly as one of the contributing factors, increasing the risk of stroke and heart disease. So we would need to really think about, again, making sure the medication specifically that can help bring down the top level number is given, actually. Yeah.
Yeah, thank you. And Annabelle, if I could ask you, there's a general question about what medications are used for blood pressure, and clearly there are many. I don't expect you to give all the names, but a general feel for it, and what potential side effects there might be from these medications themselves.
Thank you, Lalitha. So it's a very, very good question. So we've got several groups of different medication that work on different areas of the body to reduce blood pressure on there, and the type of medication that you're put on will, in some regards, if you're diagnosed with hypertension, depend on your age, and in some respects can depend on your ethnic background as well. So the type of medication will vary from individual to individual based on specific circumstance on there. And there's a group, there's probably 5 or 6 different groups of medication in which there will be lots of different medications within those. So not every patient will be on the same medication. It's an individualized area. For the majority of patients, they'll generally have no side effects from their medications. For that small minority that do develop side effects, generally they're quite mild side effects that are tolerated. Those can be things, Yusuf, you can probably enlarge on this more, but it could be anything from a tickly dry cough to mild ankle swelling. And it will depend, obviously, then whether we've got your blood pressure controlled, because if we take your blood pressure too low, that can cause other complications, such as patients developing dizziness, for example. But I think the main thing to reassure patients is that they are very well established, very safe medications that can be taken in the long term, generally very well tolerated with few side effects. And if patients do develop those, then their healthcare professional can help them navigate what might be a suitable alternative to them.
Thank you, thank you. And Tessa, if I could come to you and just ask you to tell us a bit about the effects of smoking on blood pressure and how one can quit if they want to, what help is available?
Yeah, smoking's really, really important. So not only does smoking put up your blood pressure in itself, it increases your risk of high blood pressure and makes it more difficult to control your blood pressure if you already have high blood pressure. It's really important that if you smoke, stop. And if you need some help to stop smoking, then there is help available for you. If you look at your, so there will be a link in the chat, or you can look at your local public health page for the council area that you live in, and there will be information about stop smoking services there, or your community pharmacist can help direct you, or your GP. So there is help out there if you're struggling to stop. I just want to say, while I'm talking about smoking and tobacco, I can't emphasize enough how bad smoking is for you. We're all really sick of hearing it, but we've still got quite a lot of people smoking. And if you smoke, you really, really need to think hard about stopping. Now, I wanted to say something quickly about vaping, because there's been quite a lot in the news about vaping. And I think, vaping is a really valid option if you're really struggling to quit smoking, because we don't know about the long-term effects of vaping yet, but what we do know is that it's less harmful than smoking is. So, if you're really struggling to quit and vaping's an option for you, fine, then use vaping as an alternative. But don't start vaping if you don't smoke or vape already. It's not something that we want people to be taking up. It's not a good thing to do, but it is a useful tool if you're trying to actually quit smoking. So yeah, that's it. Don't do it. Don't start. If you do smoke, please stop.
Thank you. Thank you for that. Good advice. And there's a question in the chat about pregnancy and blood pressure medication. So I'll just take that very quickly. So being on medications to control your blood pressure doesn't by itself affect the chances of getting pregnant. In fact, if you are thinking of getting pregnant, regardless of your age, you should consult your clinical team in primary care, your GP or other professionals, because they could change you to medications that are safe for you to fall pregnant with. So please do that if you're thinking of pregnancy. And then once you're pregnant, it's really important that your blood pressure stays well under control. There are special checks that are done to make sure that you do not have another condition called preeclampsia on top of your high blood pressure. And as you go through the pregnancy, you're monitored more carefully, the baby's monitored more carefully. After you deliver, the medications are switched back based on your particular need. So I hope that's answered your question. I want to come to Yusuf. and ask you to touch a little bit on stress. We know that stress does put everybody's blood pressure, but as Natalie said in her video, it's easy to say control stress, not so easy to really do it. It's almost become a way of life. Any suggestions you have for our audience, please?
Yeah, thanks, Lolita. Stress is our body's response to pressures from challenging life situations. So it's not unusual for someone to feel stress. But if you're feeling like you're stressed more and more often, then it's probably time to make some changes. And there's two pieces of advice that I'll give you, but before I do that, I think it's also important to acknowledge the relationship between stress and anxiety. They have similar symptoms, and sometimes they're hard to spot. Where stress, as I mentioned, could be your body's response to a trigger, such as a job interview, busy day at work, or something else. Anxiety is usually caused by stress. It's a long-term feeling which generally doesn't go away. So it's important to kind of recognize that relationship between stress and anxiety, and to understand that they can coexist. So the two pieces of advice that I would give is, firstly, understand and recognize when you are stressed. It's very important to recognize the symptoms, and some of those symptoms can relate to emotional states, so feeling upset, feeling tearful, getting angry, feeling alone or hopeless, feeling uninterested in life. And some of the physical symptoms could be, headaches, dry mouth, tiredness. So the first piece of advice is really recognize what stress looks like for you, and also understand that different people experience stress in different ways. The second advice I would give is to understand the causes of stress. And some of those I mentioned could be related to work, could be related to major life events, could be related to relationships and family life, or money worries, or even health worries. So understanding perhaps these causes, as well as identifying some of what the symptoms for you look like, are big steps in managing stress and anxiety. And then seeking help, seeking support. And the British Heart Foundation, as Seema would just put that in link, has a wonderful pack of resources that gives you more information around stress and high blood pressure, as well as stress and other health conditions, but also helps to signpost you to support that's available in your community through charities, but also healthcare professionals. So I would say understand stress a bit better, understand the symptoms that might look like stress for you, have an understanding on perhaps what the causes are, and lastly, seek help.
Thank you.
Thanks.
Thank you. Thank you very much, Yusuf. So what I'm going to do now is, in a moment, I will ask Ollie to demonstrate our website with the resources that are there. But if I could kindly ask Dr. Nanda and Annabelle to look at 2-3 of the questions in the chat. There's one on medication, Annabelle. I'm hoping you can answer that in the chat. There's one, Niti, about graded walking and somebody who feels hot and sweaty. Yeah, thank you. So if you can please have a look while Ollie is demonstrating and answer those questions in the chat, I would be really grateful. And Tessa, there's something on food, and if I sort all my meals out, etc., can I get my blood pressure better? So I'd be grateful if the 4 of you could do that. Ollie, would you like to demonstrate our website so people can go away and look at it in detail? You can explain and speak them, talk them through this, really. Yeah.
Yes. Okay. Thank you, Mahmood. Just checking that everyone can see that, the web page.
Yes, we can. We can.
Okay.
Yeah.
So I can take the web address and put that in the chat for people to access more easily. So this is on the Friendly Health and Care website, so the wider health and care system website, and this is aimed at being as public and patient friendly as possible, and we do make changes as and when people point things out to us. So it's a live thing, so we, if anyone has any advice, or if there are changes that come through the system or from regional or national government, or through the accepted wisdom around any of the conditions, then we'll make changes to reflect that. So it's really along the same lines as people have been speaking about in the meeting so far. It's about what high blood pressure is, what it means, and advice as to how you can check what yours is, and then if you do have high blood pressure, what you can do about it. So as you go down, you'll see there's advice on home monitoring machines. So that should take you through to that goes through to the British Heart Foundation, where all these blood pressure monitors are ones that have been approved by the British Heart Foundation. So so that removes the uncertainty you might have around, if you are thinking of getting one yourself, which to get. We have a clickable link there. This is a leaflet that we have produced that you can print out and just keep close to hand at home, or you can just simply go back to the website and quickly refer to it again if there's anything that you've forgotten about checking your blood pressure. We have Nithi, who you'll recognise from the panel here, checking his blood pressure, or showing how to check his blood pressure. And if that video doesn't load properly in here, there's an extra link there that will help you to get straight to the video. Talking about the risks, again, as has been explained during the session, there is specific instruction here as to what to do when checking your blood pressure. So in terms of sitting still, not talking, legs, feet flat on the floor, and also having not been exercising or smoking or drinking immediately beforehand. So just some of the basics, but they are important, obviously, because as has been explained, how you measure your blood pressure is important, because it's important that you get the right reading. So there is also another video that you can watch there, and you can also take a heart health quiz if you're interested to see where you stand. So it's also got information, as Yusuf was talking about how local community pharmacies might be able to help, because not everyone has a blood pressure monitor at home, and also you might want some advice following your blood pressure reading. And then there's also the generic information that Mahmouda has put in the chat to show sort of roughly where you should really be. So if your readings are outside these ranges, then it might be time to do something about it, take some action. And there's also an NHS webpage where you can click, and once you've taken your reading, you can actually go to this website and you can go through a process where you can put your blood pressure reading in, and it can then tell you a bit of information about that. Then, as I said, we get down to information on what you can do about controlling or lowering your blood pressure depending on where you stand, and we've got specific advice and some information here on what Dr. Baron Kumar in Slough has been doing. We've also got real life case studies. I have a vested interest in this because you might recognize me there, and these are other sort of colleagues and people who took their blood pressure and had a bit of a wake-up call at some point in the last few years, and so are doing things or have been doing things about it. More information, more links there. We're not trying to be the experts on absolutely everything. We're more than happy to signpost to the specific experts. So some of these some of these links will take you to other places with more specific advice. And getting further down towards the bottom, we've got some easy read leaflets, because we appreciate that some people may struggle to understand some of the advice. So there's easy read information there. And we've even managed to get a translation into Hindi, and we're working to see what we can do about expanding our range of information in other languages to cater for the many different groups that we have across our communities.
Fabulous, fabulous. Thank you. And thank you, Mahmouda, for putting the direct link where people can just click on it and take them to the Blood Pressure Know Your Numbers page of the Frimley Health and Care site. So I would like to say thank you to everybody for joining us. Thank you to the panel for imparting advice. But I just want to also ask you to let us know in the chat, and we will be sending you a feedback form as well. If you enjoyed and found this session informative, we'd like to do more of this on various different topics, be it on women's health or managing children's health and so on. So please let us know if you like the format, if you found the time valuable. And I want to say that your presence here has signified a significant commitment to your health and your dedication to spreading awareness on this critical issue. And so we know that blood pressure is a condition which can affect any of us. We've heard how you can access pharmacies at no cost to know your numbers. So please regularly monitor your blood pressure, understand what your readings are. Knowledge is the first step. Small changes that we make in our life, like you've heard about the food, the stress, salt, exercise, and so on, smoking, all these can lead to significant improvements in our well-being. Share the knowledge of what you've heard today. Stay committed. Take care of your health. And as you leave here today, just feel empowered to do this. Remember that your health is in your hand and it's worth every effort. So thank you so much. And I hope you will reply on the feedback that Ollie sends as well. Thank you all. Have a great evening, whatever's left of it.
Thank you.
Thanks, Larry. Thank you, everyone.
Thank you.